All right, let's jump right in. When someone survives a huge medical event, something like a cardiac arrest, the fight for their life is, well, it's really just getting started. Even after doctors get the heart going again, a whole new battle begins, a silent one, and it's all about saving the brain.
So you have to wonder, what is this hidden danger, right? What's the next big threat that doctors are up against in the ICU? I'll give you a hint. It's probably not what you're thinking.
It's the body's own heat. Yeah, a fever. See, in a patient who's critically ill, a rising temperature isn't just, a sign of infection. It's actually a devastating secondary injury, one that can completely sabotage their chances of recovery.
And that brings us to our first big topic, the danger of fever. So why is something as common as a fever so incredibly dangerous for a brain that's already so vulnerable? And look, this isn't just a theory. We've got hard data to back this up. What you're seeing here is pulled straight from stroke management guidelines. We're talking about studies with thousands of patients, and the conclusion is crystal clear. Higher body temperatures are directly linked to worse outcomes and, unfortunately, a higher risk of death. It's a huge deal.
Okay, so if the body's own heat is the enemy, what do we do about it? Well, this is where medicine gets really proactive. We don't just wait and see. We move into a strategy of actively cooling the body to protect that very fragile brain.
And this therapy has a name. It's called targeted temperature management, or TTM for short. It's pretty much what it sounds like. It's a medical therapy where doctors precisely control a patient's body temperature. They're not just letting nature take its course. They are actively managing that temperature to protect the brain from any more damage.
So how does it actually work? I mean, why does cooling help an injured brain? Well, it has some really profound effects. Think of it like this. It reduces the brain's metabolism. It's like telling an engine that's overheating to just slow down, use less fuel. And that simple act helps limit dangerous brain swelling. It brings down the pressure inside the skull, it calms down all those inflammatory processes, and at the end of the day, it helps stop more brain cells from dying. It's a cascade of positive effects.
And I want to be really clear here. This is not some new experimental idea. No, targeted temperature management is literally written into the standard of care by the world's top medical organizations. So let's take a look at what the official guidelines actually say.
Let's start with cardiac arrest. You've got the two biggest names in resuscitation guidelines, the European Resuscitation Council and the American Heart Association, and guess what? They are on the exact same page. There's a global consensus here. Managing a patient's temperature after a cardiac arrest is absolutely critical.
In fact, the American Heart Association makes this one of their top 10 take-home points. That's how important it is. And we're not talking about a quick fix. For patients who are unresponsive after their heart's been restarted, the guidelines say you have to maintain this temperature control for at least 36 hours. That's a day and a half.
The European Resuscitation Council, they get even more specific. They put a hard number on it. They set a clear upper limit. You have to actively prevent fever by keeping the temperature at or below 37.5 degrees Celsius. The goal is to stop the body from getting even a little bit too warm. And get this. This is the official treatment flowchart from the European Resuscitation Council. Look where prevent fever shows up. It's not some afterthought. It's right there at the top, right after the absolute basics like airway and circulation. And then, look again. It's the very first thing listed for management in the ICU. It is a constant top-level priority. And this whole principle isn't just for cardiac arrest. It goes way beyond that. For something like a traumatic brain injury, a TBI, the best practice consensus strongly recommends what's called controlled normothermia. That just means keeping the temperature in a really tight range, between 36 and 37.5 degrees. Once again, it all comes down to one thing: preventing fever. What's really cool is that TTM is such a versatile tool. It's not one size fits all. You can see how it's tailored for different problems. So for an acute ischemic stroke, the goal is normothermia, just preventing a fever to help improve the outcome. But for a newborn baby who suffered a lack of oxygen to the brain, the strategy is way more aggressive. It's called therapeutic hypothermia, and it means doctors deliberately cool the baby's body down even more, all to protect that tiny developing brain.
And it's pretty incredible, actually. The American Academy of Pediatrics recommends cooling these tiny, vulnerable infants to between 33.5 and 34.5 degrees Celsius for a full 72 hours. That's 3 straight days. It's a really powerful therapy that's been proven to reduce the risk of death or serious disability. Okay, so this brings us to what I think is the most important, the most crucial insight of this entire explainer. When we hear phrases like prevent fever or maintain a normal temperature, what does that actually mean when you're talking about these incredibly sick patients?
Right, here's the real kicker. You and me, our bodies just kind of maintain a normal temperature without us thinking about it. But a critically ill patient, their body just can't do that. After a huge injury, their whole system is haywire, it's an overdrive, and their body is actively trying to spike a fever. Its default setting is to just heat up, to push way past that normal baseline temperature.
And that is exactly why the guidelines don't just say, check the temperature every so often. No. The European Resuscitation Council explicitly says you have to use technology, things like surface or endovascular temperature control devices, to manage the patient's temperature. They know this isn't a passive process at all.
And that, right there, is the main point. For these patients, maintaining a normal temperature has nothing to do with a warm blanket. It's the complete opposite. It means you have to actively cool them down with specialized medical equipment just to fight their body's powerful urge to overheat. You're constantly working to keep them in that safe, normal zone.
And again, it's not just for cardiac arrest. We see the exact same logic in the guidelines for stroke and for brain hemorrhage. They recommend using automated feedback-controlled devices whenever you can. And you might ask, why automated? Well, it's because you need a smart, responsive system that can constantly fight back against the body's fever response 24/7 to keep that temperature exactly where it needs to be.
So when you step back and you look at all this evidence, the picture becomes incredibly clear. Targeted temperature management isn't just a nice idea, it's a fundamental pillar of modern critical care. It's a standard of care.
So let's just quickly recap the big takeaways here. Number 1, fever after a brain injury isn't just a symptom, it's a dangerous secondary attack. Number 2, targeted temperature management is a crucial therapy to protect that brain. Number 3, this isn't controversial. It's backed by global guidelines for cardiac arrest, stroke, TBI, you name it. And finally, the most important point of all, maintaining a normal temperature for these patients almost always means using active cooling technology to fight off a fever.
And all this leaves us with a really fascinating question for the future, doesn't it? We've seen how powerful this therapy is for the brain after things like cardiac arrest, stroke, and TBI. So as our technology gets even better, even more precise, could temperature control be the key that unlocks better recoveries for a whole host of other medical conditions? It's really something to think about.